on YouTube? Today we're going to be going over a breathing technique to help reduce your stress, anxiety, as well as low back pain. And before we jump into today's video, I want to talk a little bit about pressure management and how that can be contributing to your back pain. Pressure management is a very important topic to talk about with individuals with low back pain. This is because as we go about our daily life, we can increase the intra-abdominal pressure within that abdominal cavity, and that pressure has to go somewhere. One spot this pressure can go is towards the low back, and it can be contributing to our low back pain. So how do you know if you have poor pressure management? The first indication that you have poor pressure management is what's called a diastasis recti. That's when we get this dome shape in the middle of the abdomen when we increase intra-abdominal pressure. A couple common times that we do increase that intra-abdominal pressure throughout our day is when we're getting out of a chair, we're lifting something heavy, or we're getting up out of bed. Another thing that can indicate or contribute to that poor pressure management is how are you breathing at rest? So are you using your shoulders to breathe, or are you using your belly to breathe? If you're using your shoulders, you're likely not using your diaphragm properly, and you're going to be increasing your intra-abdominal pressure while you're at rest. There are other causes and indications for poor pressure management. The last one I'm going to talk about in this video today is lifting mechanics. So when we're lifting a heavy object up, are you holding your breath and squeezing everything that you have in this abdominal region? What this does is it helps to create a brace. However, it increases the intra-abdominal pressure and can be contributing to your low back pain. So if you want this to stop, there's two things that you can do. Number one, stop holding your breath, and number two, strengthen your core. If you want some ideas and help with strengthening your core, go ahead, click the link above. This is a video on ab exercises safe for individuals with low back pain. Other than strengthening your core, we can control and manage poor pressure to help reduce some of the stress on that low back. Today we're going over a technique called diaphragmatic breathing to help manage some of this pressure. If you stay to the end of the video, I'll be going over the number one way that individuals increase their intra-abdominal pressure and how you can avoid it. Aside from helping the poor pressure management as well as decreasing some of the stress on the low back, diaphragmatic breathing actually massages a nerve called the vagus nerve. This nerve is a part of the parasympathetic nervous system, or that rest and digest. So along with decreasing some of that stress on the low back, it'll help reduce stress, anxiety, muscle tension. It'll help improve gut health and also improve relaxation. A great time to do this is while you're laying in bed before you go to sleep at night. If you're getting some value and knowledge out of today's video, let me know by hitting that like and subscribe button. Eventually, we would like to perform this technique anytime we're performing restful breathing, but for starters, we're going to lay on our back on the bed with our knees bent and our feet flat on the bed. Then we're going to put our hands over our belly and take a big, deep inhale. This breath should fill up the abdominal cavity, and your hands should elevate as you take a breath in. Then as we exhale, we should feel the belly lower and the body relax. At no point throughout this breathing technique should you feel your abdominal muscles contract. We're going to do this for 1 to 5 minutes for best results, as many times as we can a day. Now for my top secret bonus tip on how you can avoid one of the most common mistakes that individuals make that spike their intra-abdominal pressure. So when most individuals get out of bed, they perform this crunch motion and slowly swivel around. That spikes that intra-abdominal pressure. A way to avoid that is simple. All we have to do is roll on our side, swing our legs off the edge of the bed, and then push up so that our back stays stable and aligned throughout that whole time of us getting up out of bed. Let me know if this breathing technique helped reduce some of your stress, anxiety, and low back pain in the comments down below. And as always, thanks so much for watching, and don't forget to like and subscribe.